today. And I'm excited to introduce this wonderful collaborative between iQPay, Frontier Veggie Rx, and Safeway here in Oregon. And we have a network of folks throughout the state of Oregon and Washington. Welcome, Washington folks. We're glad you're here. Who are interested in this technology platform and how things are working on the ground with retail partners and with the actual VeggieRX prescription. So we have Riley and Lisa from iQPay. We've got Faith from Safeway and Marcy from the Frontier VeggieRX program in Eastern Oregon. And feel free to introduce yourself even more if you'd like. And if I've misspoken, please correct me here too. But I'll go ahead and pass it over. And if folks are just joining, you're welcome to introduce yourself in the chat as well. And I think I can go ahead and monitor the chat if you do have questions. And would you all prefer questions at the end or throughout?
So let's get started, and I think let's maybe do a high-level overview of the concept, and then as we begin sharing specifics, if you have questions, by all means jump in and ask the questions, because those are important. But if you don't mind, Kaylee, I'll just start off with kind of an introduction. Faith Bontrager, Food and Security Solutions, with Albertsons. You may know us as Safeway in your area, or if you were ever down in California, Pavilions, Vons. We've got 20 different banners. So if you were out east, Acme, Shaw, down in Texas, United, Market Street, Amigos. But in all of our divisions, we say our purpose is to help people gather around the joys of food and to inspire well-being. And we began to note that there were some of our customers that had a harder time coming to the table because they didn't have the funding to access the healthy foods, the fruits and vegetables. And we determined to do the best that we could to be a partner working with groups like yourself that are very active in the community, and make it as easy as possible to work with our stores when it comes to that. I began working with Marcy, a year and a half ago, I think, with the Frontier Veggie Rx program. The time has gone very quickly. She had actually started in our division with paper coupons. And in many cases, I'm seeing produce prescriptions with paper coupons, vouchers. It's something that's a challenge for the individual, maybe some stigma associated with it, but it's all we had. And we got to crawl before we can walk, before we can run. And we were committed to say, we're going to do what we can, and then we're going to make it better. And I see Lauren from Washington State, similar things there. Even before I was with Albertsons, Lauren worked with our public affairs director, Sarah Osborne, for SNAP Match and produce prescription programs. Again, we started with some kind of tenuous methodologies, but said we're going to do something, and then we're going to continually improve it and make it better. And as I worked with Marcy, as we worked with Washington State, we have really worked to improve our SNAP Match programs. And we are now bringing this as a new opportunity for a totally non-stigma experience for the customer, for something that's very easy for the administrator, that provides a portal that updates on a daily basis. So whether you need your reports on the 1st of the month or the 15th of the month or the every other Tuesday, I don't care. It's available. We've tried to make a good stewardship of funds. So you will see as Lisa and Riley are talking, that this is a fund and redemption model. That if you issue a produce prescription, if you issue 100 of them today, there's going to be 30 people that run directly to the store because they have no food in the house and spend everything that they can spend for this month and take the healthy items home to feed themselves and their family. There'll be some that never touch their card. There'll be some that spend it down to a certain amount And so what we have done is we partnered with iQPay, a wonderful partner, to say, let's make this easy for the customer, for the group administrating it, and to provide data that say, where is the value of a produce prescription or a food prescription? Where can we show how this changes clinical outcomes, how this reduces health care cost, how this reduces nutrition insecurity in our communities? Because we all know if we are going to continue these programs, we have to ultimately demonstrate at an actuarial level the value of these programs. And you probably are all following the GusNet programs. They just came out with their 4-year program. Once again, indicated that participating in these programs, a person that participates in these kind of programs eats more fruits and vegetables than the average American. And as they participate in these programs longer, the value continues to improve. So that's kind of the heart at why we have this partnership. Marcy, if there's anything, or Lauren, if there's anything that you wanted to say, please jump in, and then I'm going to turn it over to iQPay and ask for a demonstration of the program. Lauren or Marcy, any comments?
Yes, thanks, Faith. This is Marcy McMurphy, and I work for Eastern Oregon Coordinated Care Organization and Greater Oregon Behavioral Health Incorporated. And I manage the Frontier Veggie Rx program for Eastern Oregon. So that's all 12 Eastern Oregon counties. However, we have the program in only 7 out of the 12 currently. Hopefully, with moving to this platform, we'll be able to expand to the other counties. But this partnership has just been fantastic. And Faith, yes, it has been a while that you and I have been partnering in this, and I'm so thankful for your willingness to get involved and to help create solutions. And I just am super appreciative of that. And then just having started using iQPay, we went live on July 1st, and already we have 220 people all signed up. And a vast majority of those signed up are already using their cards. So I'm super excited about it. I can't wait to share more, but thank you, Faith.
And I didn't think I was going to say anything, so I'm not totally prepared. But
you don't have to, but you can.
Yeah, we work very closely with Faith and their team at Safeway in Washington State here. And our prescription program is offered in all Safeway Albertson stores across the state of Washington. And Faith and I have been working closely to move to a non-paper-based solution, and we have a few irons in the fire. So we're just here today to kind of be a fly on the wall and hear what iQPay has to say.
Right. Riley and Lisa.
Fantastic. Hi, everybody. I am so thankful that all of you signed in today, the day before a holiday. I'm shocked to see so many people signed in, and we really appreciate you taking the time to learn more about iQPay. I'm Lisa Coleman. I lead our food and health initiatives at iQPay. In my previous role, I led a healthy living team in the retail space for a grocery store, and we used iQPay as our solution for produce prescriptions. So after 17 years in that role, I believed in the solution enough to come to iQPay and champion this solution. We actually ran a produce prescription program back in 2019 in Washington, D.C. in partnership with DC Health and in partnership with DC Greens, which was a nonprofit. You may have heard about that Produce RX program. And we started with a paper voucher. And during COVID, we went to a loyalty card solution. And we just, I'm very familiar with the challenges, is all I'll say. And so having a digital solution like iQPay can really help solve for some of those hurdles. So I'm here with Riley today. She's feeling under the weather, so I'm going to do the talking. You're stuck with me today. But Riley's here. She's my partner in crime, and you'll see us on follow-up calls. She's also going to take copious notes, so we capture all of your questions and can follow up with you on anything that we don't cover today. So Riley, if you could share the deck. And I'll just go through a high level of the solution.
Yep, absolutely. And I manage food solutions here at iQPay. I'm a dietitian, and I worked in community engagement prior to this role with United Healthcare, working in some food deserts and working with those that are food insecure. Let's see. Okay. All right. Okay, can everyone see this?
Yes.
Perfect.
Fantastic. So what we're talking about today is digital food cards. So if you could go to slide 3, Riley. So we're making it easier for you to issue a food card for fresh and frozen produce. We also offer other catalogs, what we call, guided spend. And so you're able to guide the purchases of either a single product, or in your case, if you're running a produce prescription program in partnership with Albertsons, you can guide either fresh produce or fresh and frozen. And we're working on the fresh, frozen, and canned catalogs as well. And so the benefits of using a digital card is that, we can get you up and running in as little as 2 to 4 weeks if you're using one of those standard catalogs that we've worked with Faith to create. And you can issue those benefits and rewards in real time, one-on-one to an individual person, or you can upload a file and issue hundreds or thousands of cards at once. And then again, what Faith was saying is that it's fun and redemption. So you're only paying for what is spent by your participant. And we like to just kind of show you how other organizations are using the guided spend technology with iQPay. So we have some local hospitals that are offering a $50 ATF card. ATF is everything except alcohol, tobacco, firearms, lottery, and gift cards to diabetes prevention program participants who are meeting those attendance requirements. So they're kind of using it as an incentive. And then we have a health department that's offering $40 a month stipend for diapers and wipes. So they're issuing a card that's only good for those specific items. And they're doing that, during home visits for people that are meeting those eligibility criteria. And then finally, Produce RX programs. So having clinic staff who are issuing, a benefit for fresh and frozen produce to patients who are experiencing chronic disease and food insecurity. So the next slide will give you an idea of how this works. And if you can scan this QR code now, or we can send the deck to everybody after this call, and you can kind of share this with your colleagues and practice and see the user experience yourself. But essentially what happens is you have your program administrators either by QR code or going into our portal, into our platform, and you enter the participant's name, phone number, and email address. So that's only information that we ask for. And they instantly get a text message, and that text message is coming from your organization. It's not coming from iQPay. It's coming from you. They know and love you. So they want to hear from you. And you can kind of personalize that text message. And then they click on the link in the text message, and it opens up a branded digital card. So in the digital card, again, that is branded to you. So you choose the color of the card, you add your logo to the card, you choose the messaging and add your organization name at the top. And you'll be able to kind of click around when you receive this card to your phone. But what they would do is they would click here to choose their retailer. So they would see a drop down of the Albertsons brands. They'd choose their brand, their retailer. It opens up the cashier instructions for a seamless user experience at the register. And they use that as the form of payment at the register. And there's no app to download. We didn't want to have an app. We just wanted to keep it, easy for the user. There's also the ability to choose the language that, right now we offer the cards in Spanish, Cantonese, Mandarin. You let us know what languages you would like to see on the experience. So there's a couple of benefits to using iQPay as a solution for your Produce RX programs. First is the fund and redemption, which we talked about. And this just means there are no lost funds because you're only paying for what is spent. You know, and gift cards, they typically have, you know, a 15–20% breakage. And we ensure that there's no unredeemed funds. And then that allows you to take those funds that were not used, that you originally budgeted for a person, and transfer them to someone else or use that money for a different purpose. The second benefit is saving on overhead and admin fees. We are working with a lot of community organizations, including food banks and nonprofits, who are managing food programs, but they're doing it with paper vouchers, they're doing it with retail gift cards. And so they're finding that that requires a lot of SOPs related to managing those gift cards. So they're saving on delivery of food boxes, they're saving on the printing and the distribution of paper vouchers, and they're finding this to be an easier experience from an admin perspective. And then you have access to the data. So you can sign into the portal and you can see who has used their card, how much they have spent with the card. So if let's say they receive a $30 benefit, you can see Mrs. Jones has used 25 of the $30 or hasn't activated their card. And you can say, you know, do you have any questions? Why haven't you used your benefit? And you can follow up. You also have access to aggregate data on what was purchased with the card. And that allows you to demonstrate program impact and show ROI for future programming. And then you have that program control. So you're defining your approved product list, for example, all fresh fruits and vegetables. And then you're guiding them to spend it within the retailer network that you've defined. And then finally, we're really proud of the user experience that we offer. We've invested a lot of time and sweat and resources into developing the current user experience. So that participant is receiving the card from your organization. They can receive it in the language that they would like to receive it in. And the card balance updates in real time. So if they have a $50 benefit and they go into the store and they use $30 of that, it will immediately, as they're walking out of the store, that balance will update to $20. And then finally, they have access to our customer support team. So there's a number on the card that they can call if they have any questions. I'd like to kind of talk a little bit about the how to think about setting up your program. So there's really kind of 3 parts to that. So first you need to think about your catalog, then how you're going to issue the benefit, and then how often the benefit is. So just kind of breaking down how to think about building your own program, because we're not coming to you with our own program, we're supporting the program that you have designed. So first you choose your catalog. So is it a single product? Is it, you know, all fresh, frozen fruits and vegetables, or is it that exclusion catalog of the ATF card, everything except? Then think about how you're going to distribute that benefit. You can go into the platform again and distribute one by one to each person. You can upload an eligibility file, or you can use a QR code, and we call that a self-enrollment. So if you have somebody on site, they give someone the QR code to scan, that person puts in their own name, number, email address, and can receive the benefit within a minute or 2. And then just think about the frequency. Is this a one-time benefit? Is it scheduled on the first day of the month, or is it, you know, scheduled multiple times on a specific cadence that works for your program goals? And then as an admin, you have access to the platform, and you'll be able to see all of your different cohorts, all of your different programs, all of your different offers, all on one platform to be able to see that data. And then we just like to be really transparent and upfront about our pricing and how this works. Because of the relationship with Albertsons and the referrals from Albertsons and the great work that they're doing, they've negotiated preferred pricing for Albertsons partners. And so the pricing is 5% of the card load with a $2 minimum. There are no account setup fees. There's no monthly subscription fee. There's no minimum amount of cards needed to send. So if you want to start with 10 cards, we're good with that. And then no catalog fees. If you're using one of the standard catalogs or approved product lists that we worked with Albertsons to build, there's no catalog fee. So I'm going to pause there because I feel like that gave a pretty good overview, and I'm sure there's going to be some questions that I haven't seen in the chat.
We have one question in the chat so far, Lisa.
Okay, good.
From Lexi, do the cards work at all major retailers? So in not only Albertsons, Safeway, but also Walmart, Freddy's, or Kroger brands or other brands?
Yeah, we do have a pretty robust retailer network. So today we're here partnered with Albertsons, but we do have a national network of retailers.
So cost may be different at other retailers, just, you know, to be
And
transparent.
if you want to reach out to understand what retailers are in our network within your specific geographic area, we'd be happy to send that to you.
And then we have another question from Lauren. Curious how the catalog of approved products was determined and how it will be maintained.
Yeah, so we do it at the UPC level. So we have the national UPC list and we build the catalogs based on UPC. So we're not doing it by department like other catalogs are built by other companies or other solutions. So we build our own catalogs and manage them and update them on a regular basis.
Thank you. Are you willing to share how often those are updated? I'm having been involved in some other processes. I know that can get a little bit hairy, and sometimes things aren't always updated as, you know, new products come in. So I think that's my main question is how often is it updated? How accurate? Things like that.
Yeah, I think we're still defining that cadence, to be perfectly honest. We know that the catalogs are the most important thing for the user experience at the register. We've talked about a monthly update of all of our catalogs. If we find that the user experience requires us to do that more often, we're certainly willing to do that. We are aware that other solution providers are updating their catalogs on a yearly basis. And as a user experience, as somebody who used to run produce prescription programs, I fully understand that people need to be able to have a good experience at the register and know that it's going to work. So yeah, right now we're doing it on a monthly basis, but if we find that we need to do it more often, then we will do that.
This is Marcy. I just wanted to jump in with, Lauren, you heard that we just launched on July 1st, and I say that Safeway and iQPay were ready to do that on June 24th. I have to admit, I was not ready on June 24th to do that. So July 1st, so just a couple days ago we started. And we did have a couple, well, I know one household that called their prescriber and stated, hey, I just tried to buy strawberries and grapes and it didn't go through. But the other produce that I purchased did go through. So with Teresa, who's my direct contact at iQPay, who I've been working with, she said, have them call customer service with the UPC number. And they did that, and they immediately added it to the list, and the household went later that day and purchased them. So they've been really responsive as far as following up just with me as the main admin for it, figuring out how to input people and all of that. But also so far, and we, like I said, we have 220 people who I've sent out issued cards to, I guess is the best way to say that. And already, I mean, that day, the day that I issued it, people were already like going through their phone, because that was our concern here in Eastern Oregon, that we don't have necessarily really good internet connection everywhere. And so we were concerned, will people actually do this or not? But no, they immediately were. And like within, I was shocked, like within 2 hours of them getting their cards, they had made purchases, and which was amazing. And we do find that with our paper vouchers at some of our other stores, that people go and use their whole booklet, like as soon as they get them later that day, they're at the store purchasing them. So it was really nice to see that like immediate usage with the cards as well.
That's really helpful, Mercy. Thanks for the testimonial. I think regarding catalogs, it's never going to be 100% perfect. And the scenario with grapes and strawberries could be that maybe perhaps Albertsons is sourcing them now from a new farmer, or that UPC wasn't in the database. But again, we will always be responsive, and we can easily update a catalog in real time when we're aware of an issue.
And if I can also jump in and say, customer service at iQPay has been fantastic as we begin to work together, and that is available for the customers to call directly instead of calling you and you calling me, and I call the stores, and we've attempted to work that way. And Marcy and Lauren, we've talked together with that. And I also see somebody, by the way, from Oregon Double Up. Thank you. It's another SNAP partner. But when the customer can directly call customer service and have someone to say, I'll add those grapes in, it's fixed for that customer, it's fixed for the next customer, who's also buying grapes. And customer service has been, great with the individuals. Don't want to stop on this question if there's follow-ups, but Anna, I see your question about an option for catalogs of healthier foods. We are definitely working towards some additional catalogs, and that is definitely one of them. If you have a suggestion for the catalog that you would love to have, please put it in the chat. What we have considered is an all grocery catalog minus the sugar sweetened beverages and perhaps the snack aisle. We're bouncing around several different ideas, and if there's something that you would recommend, please put it in the chat. It's something that we'll look at. I see Carla, you have your hand up.
Yes, I have 2 questions. I don't know if you might have already answered them, but I feel like I haven't received the response yet. So one for the customer service, do you have other people who answer in other languages like Spanish and other? And the other question was, so I guess with customer service, so I'm just thinking, I run a produce prescription program in Oregon, and we have a lot of issues with our participants losing their card, or they accidentally use it at another grocery store, even though we've given them the list 300 times. They go to a different one that we don't work with, and it comes up as fraud. And so in that moment, could they just call customer service and somebody would support them and help them? And then my first question was, will it be in their language?
Yeah. Currently our customer support is in Spanish and English.
Oh, great. Okay. And then I had one more quick question about farmers markets. Do you work with any farmers markets, or is it just big retailers?
We don't have a solution for farmers markets yet. So it's a question that we get very often, and we have some really great, amazing food bank partners who would love for us to figure out a solution for farmers markets. As well as they're trying to manage tokens and paper vouchers. So it's something that we're working on. Right now, the iQPay cards run on the Income OTC network. So any stores that accept Income OTC would accept our iQPay cards.
Okay, thank you. And I just wanted to say one thing. I love that you personalize the cards. I think that is that's pretty cool, because I loved what you said, what you were talking about, the
Yeah.
connection that our participants make. When you give them a card from another, they're very confused. They're like, well, who's calling me? What? And
Yeah, what is
we have
this?
the connection with them. So I just want to say I really like that idea.
Oh, I love it too. Yeah, it's really
And
fun.
Carla, we want you to have the connection because your groups are the ones that are doing cooking classes or nutrition education or working with a provider who may be dealing with managing a chronic condition. We want to enhance that relationship and make it easy for them to get the fruits and vegetables in their own communities. Because when we find people accessing the food in their own communities, I would like to say money will never run out with your programs, but we all know right now the reality is the funding is more limited than we would like it to be. And if they, on the program, find that the Signature Select frozen vegetables go on sale all the time, they're very affordable, they can now make half of their plate vegetables and fruits with things available in their own communities that they can access again. That's exactly what we want. Marcy.
Go ahead, Marcy.
Yes, thank you. So I think that well, I'm just going to say what I want to say. So so there's a few things that I just want to express to everybody here on the call. And I've been working for like a digital solution or an online platform or just something getting away from paper vouchers, because basically I touch every single paper vouchers, and we have a lot of people on the program, and our vendors touch every single paper voucher. So I've been working on it, and I always say 2 years, but I think actually it's been 3 years now that I've been
You
working
may
on
be
this.
right.
So I've started with a Wholesome Wave, Fresh Connect. I've worked with is it CDP Incorporated, and I've worked now with iQPay. And I am so thankful, and you guys will probably get sick of me saying this, that Faith has come on board with the Albertsons company, because they are a large enough company that they can really help make change and can catch the attention of some of our digital providers. And so having Safeway and Albertsons on board to help with this process, to basically like say, okay, we are a big company, we do touch a lot of states, we're worth your time, has helped us in Lake County, who has one store, Safeway, with a very small produce section. We're able to serve them, and we were able to get it started very quickly because Faith and iQPay have started this process a while ago, so that now we're able to jump in now here at this time. So it feels very fast to me now. And Baker, we have Baker City, we have an Albertsons, and we have a Safeway there. Harney, we have a Safeway there. There really are not options for our communities, and just the fact that we've been able to get it going, in my opinion, so fast with such a great partner, and it's just been really amazing. And so I know many times, people are like, oh, stay away from the big corporations. I have found that I am very thankful, very, very thankful for the big corporation that's large enough to have the chutzpah behind them to make change and to make things happen, which I'm just super thankful for. I think I wanted to say that the ease for me putting stuff in, the ease for the participants, we do $30 a month prescriptions and $60 a month prescriptions. And Lisa, I'll need to get in touch with Teresa about the scheduled orders, like doing the monthly recurring ones. I haven't done that yet. The other thing that I did for my prescribers is I set them all up with a one-time $30 prescription. And that's because I want them to go through the process and to see how it works, how they can access it. I told them not only do I want them to like get the card and use it, but then to go to the store and to use it at the store, because I want them to be able to see the whole process and experience that hands-on so that they can then help our participants who are maybe not quite so comfortable with technology and things. So that's something, and all of them were super thankful for that they now can see exactly what the participants are supposed to be seeing. So, and the other thing that I love is I can set it up by groups. So I have a baker group, a lake group, and a Harney group. So I can go and look in those groups specifically and have just those customers. So that's really nice, because we do still have our tracking form that is our internal tracking form where we have to, answer all of the questions that we need for the social determinants of health. For my EOCCO, we have to know all of that information. Like we're also tracking the 1115 waiver transition populations. We're tracking medical conditions, all of those things. iQPay, that's not what that platform is for. So I have all of that on a separate tracking form. So it's really nice only having to transfer over, and you can upload the list, the names, first name, last name, cell phone number, and then email address. And that's it. So it's, that has been super nice for me. Eventually, I'm going to have all of my prescribers be admins in it as well, so that they can enter that on their own. Yeah, so I just wanted to share those few things that so far, those are the things that I'm loving.
Marcy, thank you for all the insider knowledge there. That's really helpful, I think, especially for program operators to kind of wrap their heads around, like, okay, this is how it actually happens on the ground and with patients. And such a great idea to make sure, and so important to have that knowledge of the customer experience, so that providers and program operators can actually guide folks through that and anticipate questions or where things might go wrong in the process too. Marcy, you mentioned earlier about thinking in the counties and regions that you serve, sometimes internet connectivity is a challenge, or like the tech, as much as we all want to go to technology, because paper vouchers are infuriating and so ineffective in a lot of ways. I think when I met with the team before, I had this question, and maybe helpful for other folks thinking about folks that might not have a smartphone or an email address. And I feel like y'all maybe had mentioned that there is a way to actually print a paper voucher in those special situations where someone can't receive it on a device that they have or through email. And can you talk a little bit more about that? And I think before you had also talked about, if that paper is lost or stolen, that there are ways to deactivate that and either reissue something or just in case.
Sure, yeah. So the best user experience is going to be through the text message. But there are two other options. One is to send the benefit or the offer through email. So that way it can be printed from the email. What won't happen is when you do that is the updated balance, of course, because you have a printed copy, right? And you're using that at the register. And we're working on a product scanner as part of the user experience. If there's any question about whether or not a particular product is covered by that benefit, you would use within the digital card, you would click on the scanner and you would scan the UPC. And it would say green check, yes, this is covered, or red X, this is not covered. So that feature would not be available with, an emailed version of the offer. But everything else will work at the register. And then the other option is to print it. So the provider could print the offer and hand it to them. And yes, there is a way for us at the customer support to deactivate that offer, but also you as a program admin can easily sign into the portal and deactivate an offer.
And if the customer realizes they've lost their card or someone had stolen it, they can call customer service. And like Lisa said, that can be deactivated. If there's, yeah. And Marcy, I did want to respond. You so totally humbled me by your comment. It was like, how do I even respond? And first of all, I have to say within Albertsons, there are so many people behind me with these programs, and I'm not going to list them because I would forget somebody and leave them out. And also, I don't want to in any way disparage any programs, but we can only improve the ones that we control ourselves. And so, we have determined that we are going to be the best partner possible. And I'll let the other groups, work with other programs, but we're definitely committed to doing that. Last year we increased our number of stores that had nutrition incentive programs by 18%. I think by the end of this quarter, I'll have more than done that this year. And we're saying we want to be your favorite. I'll just say that. But without in any way putting down anyone else, but to say, what can we do to help these customers to the table, if you will? We want them to have the fruits and vegetables and the healthy foods in a way that's culturally relevant to them, in a way that they can accept it within their own community. And so we have made this a priority. And thank you to all of you who write the produce prescriptions, who work with the SNAP Match programs, who do the cooking classes, the nutrition education, the support with signing up with SNAP and WIC, and so many other programs. The nutrition insecurity in this nation is too big for any of us alone, but together we can do this.
I have a couple of questions. When does the card work for any online grocery orders that might be able to be delivered?
Soon. Yeah, it will soon. We have it set up so as soon as the OTC network is ready to do online, that we will make this program online. Income isn't quite ready yet. We're hoping by the end of the year. So that's part of the crawl, walk, run. I'm committed to fly someday.
And then I guess that's a good follow-up. I was curious, you mentioned Income and it being at the same retailers. Is there is iQPay an offshoot of Income, or is it a totally separate entity, or how do the two interact?
So we ride on the Income payment rails. So we submit the offers, we build our own catalogs, and then we submit those catalogs and the offer to Income to set up. And so we use their payment rails, but we operate separately, if that makes sense.
And the
Thanks.
good thing about that, Anna, is that we have accepted this income payment out of stores for some time now. So we've worked out any glitches as far as the adjudication at the point of sale system and continue to work with income, with other programs. So we want this program to work seamlessly at all of our registers, both regular checkout and self-checkout in the stores that have self-checkout.
And you'll see on the branded card that it has the OTC badge on the card. And so the cashiers have learned to recognize that, oh, this is an OTC offer. It's something that's familiar to them.
And then lastly, I guess I'm curious, both from the healthcare side and from your side, if there's any issues around sharing those names, emails, contact information from the healthcare into this system, for patient health information, privacy issues. I like that there was the option for a self-enrollment. Yeah, I'm just curious more what are the guidelines around that, or how would it work is there a way for the healthcare to just put in all the information somehow and assign it a code that would go to that card, or just curious about that issue.
Yeah, sometimes organizations decide not to share that information with us, particular names. You can use a code or a number or a different way of assigning somebody a benefit. But we're blind to, we don't know a person's diagnosis or why they're in a program or what program they're in. We just know that this person is to receive this kind of benefit. So we haven't run into any issues with that.
And then Anna, if you're trying to tie it back as well to a diabetes prevention program, or you're working with a federally qualified health center that is actually working with diabetic patients or something like that, you can actually assign a code number within the portal that would, in your own records, we don't want a copy of this, in your own records, link back to a patient identifier number. So you could say, with our diabetic patients that were issued produce prescriptions, A1C levels came down, 0.3 of a point, hospitalizations decreased, et cetera, et cetera. We make that easy, but we don't want that in our systems. That we keep PHI out of our systems, only PII, the name, phone number, and email. And if you want to use a code name, we don't care. We just want to know who to give the card to, and we would like to know the name that should appear. Anna, you've been issued a produce prescription by Oregon Cares. Marcy.
Yes, Anna, so that was a concern for us EOCCO, ensuring that we weren't oversharing any information, which is why we keep the separate tracking form from the iQPay platform, because then we're not sharing anything sensitive. And then in our sign up process, we do have them sign that they agree that their name, phone number, and email address can be released to iQPay for the purposes of receiving benefits.
Yeah.
So there's a question in the chat from Lauren. Is there an estimate for when canned fruits and veg will be added? And for frozen and canned fruits and veg, will it be no additives?
So I'm going to take the second one, and I'll let Lisa handle the first one. So the frozen right now, and as we build out the cans, we'll follow USDA guidelines of no added sugar, no added salt, and no added fat. Yeah. And as far as the timing of the canned, Lisa, I'll let you take that one.
Yeah. So our operations lead has told us Q3. So sometime this fall, we'll have the canned approved product list.
You guys ask great questions.
And there may be some more that come through, but I'll say, Kaylee, I'll send you the deck to distribute to the group. And then if you have specific questions about your programs or, the methodology of how you want to distribute benefits or anything that comes to mind, it's really easy to find me. I'm Lisa at iQPay.com. Lisa at iQPay.com, and happy to answer any emails or phone calls.
And Kaylee, if you don't mind, maybe share all three of our names and email addresses as you send out the deck. We're very glad to answer questions.
Yeah, happy to. Send me the deck and I will get it out to folks. This is also being recorded and we upload the Oregon Community Food Systems Network, or OCFSN, recordings on our YouTube channel. So folks can access that if you're on the call today, but just want to refresh your memory on the presentation, you can link to that once we have that uploaded, as well as other folks in the network there. And I'll share folks' email addresses too, to be able to get in contact with y'all. I don't want to call anyone out, and I also see some familiar faces, beyond Marcy at Frontier VeggieRX and with EOCCO. I see a few other familiar faces from some of the other coordinated care organizations and within or throughout Oregon. And I know the new policies coming out with HRSN, food and nutrition benefits. I'm curious to know if you all have any questions or thinking about kind of the distribution of the food or grocery benefit through HRSN. So feel free to, if you want to add any questions or thoughts around that, we're happy to have you here. Hi, Lexi.
I can always ask questions. I have a couple specific ones for iQPay outside of the scope of just Safeway. Do you ever work with, how easy would it be, I should say, to get this set up for small independent, either grocery stores or providers who normally do take, SNAP and debit cards, but maybe don't have the same capacity around barcodes / other independent grocery stores who do have barcodes but might not have a national retailer connection?
So if they accept income OTC, the cards work today. If they don't accept income OTC, they would need to scope out a point of sale integration.
Okay.
And we would connect them with our contacted income to kind of scope that out, the timeline and the cost and all of that.
Okay.
Normally, a retailer is motivated to do that if they see that they're missing out on programs. If they have the opportunity to accept, cards or benefits that are being distributed. So sometimes they'll need to put together a business case to kind of justify the investment in the integration. But that's something that we can connect them with income to kind of help them understand what that involves. There is a one-off solution for a mom and pop shop that I haven't seen in action, but I've heard about, and we can get more information about. And that's a terminal that can be put into, it's like an external terminal that can be added at the cash register. But that would not be for, large organizations. That would be for a one-off mom and pop shop.
So Lexi, to follow up on that a little bit, so that's one of the things that we're looking at in our stores, like in Mitchell and Condon and Fossil, of those stores. Let's see. The other thing I wanted to say is I also went out and sought a grant to help. So I have funds that when we're ready to look at some of the smaller mom and pop, I have funds to help them with the process of maybe changing their point of sale system to the income OTC so that we can get them utilizing this. And the way that I was able to write it is that it allows to this particular grantee, that it was allowing those in our frontier communities, very rural, very um, lack of access, that it would help them to be able to not only accept this program, but then potentially open it up to other possible programs. And we were successful in that grant application. So that's something maybe to consider.
Yeah, thank you. We have some large scale independent grocery stores. So if they don't use that system, I don't foresee them, just based on population size of the gorge, actually changing a point of sale system, but I can certainly talk to them. I know we briefly talked about farmers markets. So I was just curious if there was at all for iQPay, like just a thought that would be lovely, or if there's an actual possibility of that happening within any certain time frame, and if so, what would that time frame look like? Are we like 5 years out, a year out, 6 months?
Well, hopefully we're more nimble than 10 years. But it's something we are seriously working toward. So we're scoping it this summer and trying to understand, these kind of programs are being delivered in many different ways. It's not just one methodology for delivering, tokens and paper vouchers and how this is working. We're looking into it. I can't imagine it would take more than a year once we figure out a solution, but we'll keep you posted on what we're coming up with. And actually, one of our intern is on the phone, Annika, and this is her main project this summer. So I'm sure she's excited to hear you express interest.
Yeah, I'll just say from a CCO's perspective, there's this interesting, not tension necessarily, but difference for the upcoming HRSN benefits of both member choice, but also then so many of these VeggieRX programs are across the state, and still wanting to be able to support those programs and the emphasis on local food. But then, a lot of these bigger solutions like iQPay might not be there to accept those. And so then there's this tension of how do we make both of these work, and is that feasible? And so just want to call that perspective into this space.
Yeah.
I know here, sorry, I know here in Pendleton, we have the main table at our farmers market where they process like SNAP benefits as well. And then they just hand the tokens to the people who then use it at the individual farm stands, and then they bring those back, and that's how they get reimbursed. And so I'm hoping that that's possibly something that we can look at with that terminal, that if there is a main table that can have that terminal that can then use that and provide those tokens or something to participants, that could be a workaround way for that.
Well, we are at the top of the hour, and certainly we'll get email addresses out to folks. So if there are additional questions as you're looking through the slide deck and thinking through how you might implement in your program or your service area, happy to direct those to Lisa and Faith and Marcy, if we can list your email address too, knowing that you have been implementing this on the ground, that would be great. But just really, really appreciate the time and thoughtfulness and consideration and innovation that you all are leading the charge on a lot of this. And so really appreciate this really cross-sector collaboration that's happening to get food out to folks. Really appreciate it. Thanks everyone for signing on and listening and asking great questions. And we will see you all soon. Yeah.
Thank you, everyone.
so much.
Thank you.
Thank you.